Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am on with Dr. Millicent Rovelo via Skype. Millicent, what's happening in your neck of the woods?
That's funny that you would say that because we literally just did a podcast about necks. So in my neck of the woods, I'm looking pretty darn good, I must say.
Yeah, things are good. Weather's good here. We're in isolation and trying to do our podcast.
Yeah, that's for sure. We are isolating. We are social distancing. We got our Skype going on. So we are being responsible plastic surgeons. And today, what are we talking about?
Butts.
Butts. We're talking about some butts today.
We need to talk about butts.
You know, I can't believe it's taken us this long to get here.
Listen, butts are in right now, and they are going to be in for a while. Yes,
100%. And I got to say, I'm quite a fan of that as someone that's always been a little bit on the butt curvy side.
It's finally come around for you, huh?
I'm like, thank God.
Well, you know, that goes for the two of us. So, you know, it's always been an issue for me. I think it started when I was a catcher. They were just like, dude, seriously? I'm like, well, you know, that's how it goes. But other people do want big butts. And I think it started with J-Lo, and it continued with Kim Ye. And, you know, now you have people that want their butts bigger, and I get it.
Yep. I mean, we've definitely seen a kind of a sea change in terms of how, you know, the ideal female body has evolved from the 80s with the aerobicized, like, no curves kind of body to the 90s, which was a little more natural, if not super, super skinny and waifish. And then the 2000s really got us in with J-Lo, you know, and she was sort of the first. But then that brought in really an appreciation of, you know, curvier figures, particularly butts.
And of course, the Brazilian butt lift is the main way, I think, that people are, you know, looking to improve their butt size and shape.
Yes, which I think, to clarify, you know, the Brazilian butt lift is not really the right name for that. It did originate in Brazil, so I will give them credit for that. But it's not really a lift per se. It's really just injection of fat into the butt to make it bigger, which will also give it a bit of a lift, you know, if you're filling out a bit of a saggy skin envelope. But that's not really the point of it. The point of a Brazilian butt lift is to make it bigger, the fat.
Yeah, and in fact, when I was a resident in Pittsburgh, Louis Toledo, who wrote this original book, really, about doing lipoaugmentation of the buttocks, came through and was, you know, looking to find a place to work. He wanted to get out of Brazil because he felt it was not the safest place for his kids and his family. Ultimately, he wound up in Dubai, but I remember meeting him then and saying he was talking all about fat augmentation, and we were working on stem cells from fat at Pittsburgh with Adam Katz and Ramon Yui, and it was a very, very fatty time. And sure enough, now the Brazilian butt lift is really popular, and it's done a lot of places. And, of course, safety has improved with this operation.
Correct. And when we're talking about safety, we have to talk about, let's talk about how it's done, first of all. Then we can sort of get into, you know, what the potential complications are. So at its most basic level, a Brazilian butt lift is basically a gluteal fat transfer. You're doing liposuction, usually large volume liposuction, typically of the waist and the thighs. And then you are processing it, washing the fat, and then turning it around and injecting it right back into the butt. And the whole concept is that not only are you making the butt bigger with the fat, you're also really sculpting in the waist. That's half the procedure, is getting that really small waistline, which accentuates the hips and the butt.
Absolutely. And that's what, you know, it's the double whammy. You're making the top part smaller and then the bottom part bigger. And that's the shape that people want. They want to get They want that, you know, augmented buttocks and a thin waist. And it looks great. People love it.
And earlier on, I would say in the early days of Brazilian butt fever, we were seeing extremely large butts, like big butts with lots of fat transfer. And that's definitely still out there, and it's definitely still a look, and it's happening. But I think over time, we've sort of transitioned to a less dramatic look. You know, we certainly have people that want that, There are some that want just a smaller, more moderate version of that. And then you have the professionals and the moms that want just a little bit of enhancement, without anybody knowing that they necessarily did anything. They just want to have a butt. Maybe they never had one before and they just want a little something there. So there's sort of a whole spectrum and range now of what you can get. And so a Brazilian butt lift does not have to mean you have the Kimye butt.
No, and that's, there's definitely a spectrum, as you said. And that's where, the consultation is so key. You have to really discuss with, the patient and the doctor have to get on the same page of what you're looking for here so that you can make them, the patient wants a certain look. You have a certain idea as the surgeon, what you can do and what you can't do. And that's where the conversation has to be really candid, very open. And photos are really helpful in that discussion.
Super helpful in letting us know, as the physician, what you're thinking and what you're looking. Because unlike the breasts, which are already hard to kind of get a generic size for, what does 32D mean to you? There's no size for the butt at all. Like other than what size jeans do you wear, which it means absolutely nothing because every size is different. So there's no good way for a physician to know what you mean when, you say you want a big butt. Like, what does that mean to you? So that's where pictures are definitely super helpful.
Yeah, there's no question that because it's a look that you're trying to get. I don't like when people say, "Oh, I want to have a 32C, breast augmentation." Well, we don't have sizes that are consistent. It depends where you buy your bras, where you buy your, your shirts. I need to know what look are you looking for, not the, some sort of arbitrary, seamstress's idea of what that size is. And
Correct.
That's really
Right.
important with the butt, too. Like, show me a picture of something that you're looking to achieve, and we can tell you yes or no, or this is what we can or can't do. It's really, really important.
I couldn't agree more. So we mentioned briefly, what the safety profile is of these things. And the usual complications that go with any surgery certainly exist with this: bleeding, infection, scarring. But the real complication that has been a major concern to everyone involved in these procedures is the potential risk of death from a fat emboli. And that is a no-joke risk. It is a known risk. It happens, thankfully, extremely infrequently, but it happens, and it's real. It's something that has to be addressed.
Absolutely. And it's less and less as people have understood what causes it.
Right.
But still, if I can tell you that you have, a risk of death with you having a bigger butt, it doesn't sound exactly like it's something you want to sign up for. So that risk has been mitigated significantly. And if you read on the internet, there's all these disaster stories that you just have to now understand that we've gotten to a different point. There is a different way to approach this. We have different instrumentation. Things are way better.
Way better. We have a better understanding of the anatomy and where we're putting the fat and how to do it safely. But I think what has to be stressed so clearly here is you have to have this done by a board-certified plastic surgeon, more than I would say almost any other procedure we do, almost. This one, you really want to make sure you do your homework on. A lot of the cases that we saw in the beginning were being done by people in their backyards and garages. They were
So
being
true.
done by non-professionals, but people just went to them because they were offering these cheap butt lifts. And those are the ones that really had a lot of problems with these fat emboli. And what's happening is you're taking large volumes of fat and you're injecting it into the butt, and it gets into one of the large veins that is in the butt region, and it literally just gets sucked right up your vena cava, up into the heart and then into your lungs, and within seconds you're dead because you can't move blood around into your lungs. So we have a better understanding now of how that happens, but the people who know how to do it best and who are going to all of these meetings and understand it are going to be your board-certified plastic surgeons.
For sure. And, again, the instrumentation's different now. And, again, I've done a lot of these because anytime I do liposuction, people are like, well, can you put the fat in my butt?
Right. While you're there, what else are you going to do with it?
I'm like, it's funny because I'm like the nose guy, but, I wind up doing all these other ancillaries because people come for rhinoplasty and then you do, can you suction this out? Yeah. 20% of my patients are getting liposuction. That's I should almost have a like a package deal discount for that so that people just add it on. I mean, it's so common in my practice. And then they say, oh, then can you put the fat in my butt? And I'm like, sure, if you want a, bigger butt or, fill out some, divots or dents or things that you don't like, works great. I think fat augmentation is a really nice move on the buttocks.
Really nice move. I will just say one more thing about fat injection. They're just injections to the butt. And I feel like I shouldn't have to say this, but I'm putting that out there as a PSA. Do not inject anything in your butt other than fat. For the love of God, please. And what I'm talking about specifically are silicone, any kind of medical grade, any kind of shyster thing that people will advertise has been injected into the butts. And the problems that cause are astronomical.
Well,
there's no pun intended.
That was a super, super dorky joke, but I like it, and it's true, because I have seen polymethyl methacrylate injected into the buttocks. I mean, like a bag of like rocks of this, awful plastic in the butt. Silicone, I have cases where I had to cut off half the cheek to fix it. But what do you think about Sculptra in the butt? Do you like Sculptra?
I don't do Sculptra into the butt, although I'm not adverse to it. The Sculptra is sort of like a collagen builder, and we've used it a lot in faces, particularly we found it first in patients that had AIDS and kind of AIDS wasting, so they lost fat in their face and volume. But you can put it anywhere, and what it does is it brings on a volume of your own. You create your own collagen in that area. And I think it works great in the butt. I think it works great in kind of small butts that don't need a lot, or areas that just have a small little dimple or deformity, because it's not a lot. It's not going to give you any dramatic results, and it's expensive.
Yeah, that's the thing. It is expensive. That's usually why people don't do it. It's not because it doesn't work, but it is way pricey. Yeah. So if you got a lot of money and you want to spend it on Sculptra, we're here. We'll put it in.
Sure, no problem.
But fat is better. Some people don't have fat, so then they have to go to a Sculptra, or they can move to our next topic, which is butt implants.
Butt implants, absolutely.
I love these. I am a total fan of butt implants. I don't have a section on my website or anything, but I do them a lot. And I think it's another one of those like add-on things, or other people who've had butt implants come in for them. But I really like using these. These are nice. It's a nice operation. You can make a really beautiful butt. The implants are well tolerated. And of course, the big question is always like, well, what does it feel like to sit on them?
Exactly. How do you sit on them?
Well, you don't. You don't sit on your butt. Anybody, once you like sit down and check it out, you realize you sit on your pelvis. You sit on your ischial tuberosities.
Your sits bones, we call them in yoga.
Yeah, exactly. So you're sitting on your pelvis and your butt goes up your back. So that's where the butt implants go when you sit down. So you're not like sitting on two pillows that are really uncomfortable.
Right. The population that I like butt implants for is going to be my massive weight loss patients, which will bring us to our next topic, which is butt lifts. But when you have the massive weight loss patients who have lost a lot of weight and they have a large amount of excess skin, we will do butt lifts and remove the extra skin, but it frequently leaves a very, very, very flat butt. And these are not patients that are well served with fat injections because their skin just isn't tight. You need to have a nice tight skin envelope to really do well with fat injections to the butt. Otherwise, it's like trying to blow up, a pillowcase with a little bit of popcorn. Like, it just doesn't work. Like, it just doesn't, you have to put so much in there, even once you take the skin out, to get it to really look taut and, nice and tight. So I think that those patients are well served with butt implants. Because otherwise it would just take way more fat to fill them up than they have.
Well, in butt implants, again, if you're doing in that setting of the massive weight loss patient, and we'll come back around to the non-massive weight loss patient, but you can put them in easily, because if you're doing a butt lift, then you already have access. You're looking right at the gluteus muscle, and I think in that population, I tend to put these intramuscular.
Yeah, it's easy enough because you have the visualization. It's wide open. You're right there, and you're already taking out the skin. So I agree. I think that's fine.
But if when I do butt implants for, say, the 30-year-old mom who's lost weight after having all the babies and wants to have a bigger booty and doesn't have a whole lot of fat, I make a small incision in the butt crack, above the action area, and using that one incision in the middle, I'm able to make two pockets, and I tend to do subfascial but some patients I still have to go intramuscular. So I like both methods. And what we're talking about is where the implant lives.